One of the most devastating types of medical malpractice involves medical mistakes with anesthesia. Anesthesia providers are providing care to patients in different settings, but we most often see cases arising in two settings. One is when an anesthesiologist is behind the curtains taking care of a patient who's undergoing surgery and under the effects of sedation like anesthesia medications. Another setting where we see anesthesia errors in these potential cases is in emergency intubations, when patients need an artificial airway through an endotracheal tube that gets introduced into their trachea and into their bronchi to help them breathe. Those are patients who cannot breathe on their own, either because they have some serious lung issue or a very severe illness affecting their lungs, or maybe their upper airways as well. When we're analyzing a case like this, especially the case involving an anesthesia provider in the operating room, one of the first places we will look is the anesthesia record. Yes, an anesthesiologist during an operation keeps a very detailed record. They're behind the curtain looking at the patient's vital signs that are being monitored all along and during the surgery. And often the anesthesiologist is the first person to see a derangement in the vital signs, such as a sudden drop in blood pressure. Anesthesiologists are responsible for identifying those changes and then communicating with the surgeon. For all the anesthesiologist knows, the surgeon may be encountering excessive blood loss or a hemorrhage. And if that's the case, they need to communicate and determine what's the next step of action to support that patient's system and prevent them from losing oxygen to their brain or going into cardiac arrest due to the severe hemorrhage. The other end of the spectrum, which we talked about for these potential cases, is emergency intubations. And to be quite frank, these cases are difficult. Often it involves a very tight timeline. A patient may have swelling of their airway or be suddenly dropping in terms of the quality of their vitals, becoming more ill, and they need that artificial airway in a hurry. And what we see often is that problems arise in the healthcare setting when the right personnel are not involved. Not only the right personnel, like anesthesiologists, who are usually the most experienced people to intubate, but also the right equipment. There are different types of equipment that anesthesiologists, critical care medicine, and emergency medicine providers are supposed to know how to use. They're taught and trained how to use in order to rescue a patient who needs that artificial airway as soon as possible. And sometimes there's this last resort form of establishing an artificial airway called a cricothyrotomy. And that is a surgical airway when a tube is inserted into the trachea to try to provide air and ventilation to this patient, oxygen specifically, which they need to survive. And we see cases involving the failure of an anesthesiologist or maybe a critical care medicine doctor to take that last resort surgical airway option, even when it's the only option that might save the patient. And it all comes down sometimes to lack of experience and not having the right person in the room. So while these cases can be difficult, at Lupetin Unatin, we know the records to look for, and we know the themes and the theories of negligence that could help us overcome the obstacles of proving a case and help you or a loved one retain a recovery for a loved one who was lost.